So I appreciate everybody coming. Everybody should have a copy of the Exam 3 study guide, correct? Yes, no? Sarah's shaking her
Yes,
head.
ma'am.
Does everybody
Yes,
have a
ma'am.
copy? Okay. Okay. So with my reviews, I like to review the study guide. You have other opportunities to go to several other reviews this week, and everybody does them differently. It's the same information, but just presented differently. I like to go through the study guide. So I am going to pull up this. I'm going to share my screen and pull up the study guide. Oops, that didn't work right. Hang on 1 second. Okay, can you guys see that? Okay. So for this exam, it's going to cover weeks 6, 7, and 8. So actually, this week is our last week of content, week 8. And there's lots to cover in class this week. But it will cover the study guide will cover weeks 6, 7, and 8. Okay, lots of chapters. Same cover page. Multiple choice questions, select all that apply, math problems. And remember, couple things with exams, select all that apply. Don't be afraid to select all. Okay. There's no written rule that says you can't select all. Right. So if all the answers look correct, I hear that I bring that up because I hear that a lot of that in reviews. Okay. I hear, oh, I didn't think it could be all. All right. So make sure that if all the answers apply, select all that apply. Okay. Multiple choice. Please take, I don't know if you use the highlighter or the line through, but, use those resources in ExamSoft. If you pick up on a word in a question or a phrase or a cue in a question that seems important to the content of the question, highlight that. Okay, lots of priority questions. What are some priority words that you would be looking for in a question that might help direct you to an answer? What are some priority words?
What would the nurse do first?
First, great. Last, what's initial? What's the initial response? What's the best response? Okay, you got to be looking for those keywords. And remember, I always tell students that if you come upon questions that are not select all that apply, and you have maybe 2 or 3 answers that could be correct, and it's not a select all that apply, what should you do? You should go back and reread the question, because you may have missed an important word or cue in the question. Does that make sense? I hear that a lot in reviews with students. And then also make sure that you can identify a question as positively asked or negatively asked. Somebody give me an example of a negatively asked question. What's the difference between a positive and a negative question? So here's an example of a negatively asked question. You're observing a new nurse working with a hospice patient. What might the new nurse say to the family that is going to require more education? Meaning she says something to the family that is either incorrect or inappropriate. And what has she said that is going to require further education? Or
like questions I ask, where should the nurse intervene?
Another example of a negatively asked question: you're working with a family who smokes in the home, and they have asthmatic kids. After you go through all of your teaching, what does the parent say that she requires more education? Maybe
If she says she switched from regular cigarettes to vaping.
Exactly. Exactly. All right. So be cautious of your positive and negative questions. Okay. Be cautious if a question says, what should you not do? Right? Versus what you should do. Okay. So there's a lot of those questions on the exam. There's a lot of priority questions, primary, secondary, tertiary. At this point, you should have a solid understanding of primary, secondary, and tertiary. Each of the chapters in the book have a blue box that goes through examples of primary, secondary, and tertiary for whatever the topic of the chapter is. So if you need a review, I would highly suggest you go back to the chapters and read those examples. Okay, I would also highly suggest that in the chapters you have a look at the Healthy People 2030 objectives and goals for each of these chapters. There's several questions about healthy people. Okay, so please be aware of those.
I have a question, Professor. So
Sure.
this exam 3 is just on, as the study guide says, 6, 7, and chapter 8.
Weeks, it says weeks,
Weeks.
6,
Okay.
7, and 8.
That's okay.
Okay.
Thank you.
You're welcome. And then as far as math goes, at the end of this study guide, I've highlighted in yellow for you, there's some simple math setup equations. Okay, information on how to set up equations, about drip calculations, how to set up an infusion time, how to know how to calculate your doses. Okay, so there's a good little cheat sheet on simple math conversions or setups. Okay. What else? Remember your ABCs, your safety first. What is a priority question? We talked about that. Prevention levels in each chapter. We talked about that. And obviously your ADPI, our nursing process, our ADPI, for community, we are expected to take our nursing process and convert it into the community setting. So what does an assessment look like in the hospital for inpatient versus an assessment in the home in the community? You should have a good understanding of how that looks, how differently that looks. So if you go through your ADPI, how does an assessment look different in the hospital versus community? And then how does your planning go based on your assessment? Your interventions, in the community, it may be program planning, education. Does that make sense? So you have to be able to not convert, but you have to be able to apply your ADPI to the community. Okay, to a community assessment. It's a lot different doing an assessment of a single patient in the hospital versus a family in the community. Okay. So the study guide's broken down into different sections. Each section is concepts that we have covered. Okay, so it starts with community assessment and evaluation. Okay, when you read through each bullet, think of what questions could be asked. So, for example, community refers to the dimensions of there's 3 dimensions that are looked at with the community: people, place, and function. Okay, so this paragraph talks about each of them. All right, so when you're measuring the dimension of people, where do you get the data? Says here, census, tourist bureaus, civic groups, churches. Okay, as far as the community's function, where would you get information? Libraries, police stations, welfare agencies. And when you're assessing the dimension of place, maybe you're looking at maps, newspapers, local housing office. So what kind of question might be asked about the 3 dimensions of the community based on that information in this paragraph? What might you be asked?
Maybe a select all that apply.
Okay. Maybe you're asked, what are the 3 dimensions? right? Or you're given a scenario and asked, which dimension does this focus on? Does this focus on, if they say that you're getting information from maps and newspapers, what dimension is that? That's the dimension of place. Does that make sense? So know these three dimensions: people, place, and function, and have an idea of where you're going to be able to gather that information in the community. Okay. So next paragraph, when completing a community assessment, okay, it talks about community systems categories. That's a fancy phrase for how are you, what is an assessment in the community based on? Every community. Okay, there's 5 system categories: politics, education, it's right here, recreation, economics, and religion. So those are the 5 most common system categories that are found within a community. It will look different in every community. Maybe one community, their politics is much more in the forefront than another community, or religion, or recreation. So you need to understand what those 5 common community systems are. Okay. What's an active versus passive partnership in the community? Anybody know without reading this? What's the difference? So an active partnership, an example would be low cost snacks to an after school program. Okay, that's actively involved. That's having a direct impact. Okay, versus a passive partnership. That may be a focus group or a team that's working on planning and building a new recreation center. Yes, it's a partnership, but it's in the background and things are being planned long term. Does that make sense? So you need to know the difference between an active and a passive partnership. And then the next paragraph talks about you need to understand the difference between data generation and data gathering. Okay, for data generation, you have to generate data. It doesn't already exist. You're generating. Okay, so that may be talking with people in the community about their beliefs, their values. Okay, their social norms. I'm sorry, I said that backwards. Generation, data, you're generating information. So you're talking to people in the community, but data gathering, the information already exists. All right, from census, maybe census information, population size, socioeconomic qualities. Okay, so understand the difference between the two of them. Then the next concept that was covered was evidence-based practice. What is evidence-based practice? You got to know this for the exam. Several questions on evidence-based practice. What is it?
Is it something that's been proven already through like evidence, and it's already been, we'll say, tried? It's already proven to be effective and work.
Correct. Excellent. Thank you. Right. It represents a cultural change in practice. Right. We're always looking for best practices. Okay. It recognizes the new evidence, the new research, say for caring for a stroke patient or caring for a diabetic patient. Okay, it recognizes the new and upcoming evidence-based information that we can put into place to improve the healthcare and the outcomes for our patients. Right? Has anybody ever worked with somebody who says, oh, we've done it this way for 30 years. We don't need to change anything now. Anybody work with people like that?
Yes, they say that often regarding the way they
Exactly.
put the information systems. Like for Cleveland, I think it's I can't think of the name of the software they have to use, but yes, they
Right.
complain all the time about that.
Right. And so one of the big challenges about evidence-based practice is the motivation to change your practice. Right? People may feel intimidated. The old way was fine. We don't need to update our technology or update our systems or update something, right? But evidence-based practice is really important to our practice of nursing. Okay, so it's using the most up-to-date current information to help guide us in our nursing practice. Okay, but it does come with its challenges. So with regards to the environmental risk concept, we're asking you to review the environmental approaches to health risks, how to assess and apply prevention levels. Please go back to the environmental chapter. Okay, and review the approaches. We talk about occupational environmental concerns and considerations. What's the best way to do education with parents? Okay, how would you apply prevention levels for safety in the home and outside in the playgrounds? Right? In our lecture, we reviewed numerous occupational and environmental concerns in the communities. So you need to go back and review that. Health literacy and domains of learning. One of the biggest issues with nursing education is the health illiterate population. How do you assess it? Right? And how do you accommodate it? Right? So health illiteracy is a big problem. So that's all in your community education, community teaching, developing programs, is how do you adapt your teaching strategies to accommodate not only low literacy, but how do you accommodate special populations like the hearing impaired, the vision impaired, maybe the group that is not really motivated to learn. Okay. And then we know about we all of us have three domains of learning: cognitive, affective, psychomotor. Can you guys tell me what those are? What's cognitive? Cognitive is the thinking part. Affective is the feeling part. What are your values? What are your beliefs? How do those affect your ability to learn? And then you have your psychomotor, which is your hands-on. We all possess all these three domains, and one may be a priority. For example, for me, I'm a psychomotor learner. I really like hands-on, right? So when I need to do something electronic, I always have to call my kids, right? And they'll start talking gibberish to me on the phone, explaining how to do it. And I say, no, you got to just come over and show me. I can't do it. Does that make sense? Disaster management. He'll be covering that in class this week, but disasters, there's two kinds of disasters: natural or man-made. You need to be able to give an example of each of those. And then we're asking you to review the Healthy People 2030 objectives for disaster management. Okay, it focuses on disease mitigation. Okay, so have a look at those objectives. And then know when you're teaching a family how to prepare for a disaster, how do you educate them on how to prepare a disaster kit? That's right here. Have a look at those. Have a look. It's all right in here. Stock enough food for 3 days. Review the kit every 6 months. Make sure everybody knows where the kit is located. Make sure everybody knows how to turn off utilities in the house. Okay. And then there's a section here about mass casualty exercises. Why do we do those? We do those to see what the response time is, to see our capabilities of of responding to a disaster. And if you're in the workplace, if you work, you're probably participating in disaster drills. Okay, we obviously know that early response can decrease casualties. And early response can also increase the availability of resources. Please know what the National Response Framework is. It's right here, the NRF. Okay, FEMA is a big responder to disasters, but within FEMA, we have the National Response Framework. This particular organization has specific needs provided to the community. Okay, and here are their needs. So if you have a question about what does the National Response Framework provide, here's what they provide: transportation, temporary housing, medical resources, search and rescue, firefighting. Okay. Economic influences. We're going to be covering that this week in class. Primary prevention with regards to economic influences could be working with an insurance company. Let's say you have a patient that the insurance won't cover a certain medication for their treatment of a rare disorder they've been diagnosed with. How do you, as the nurse, proactively work with the insurance company to maybe let them know that you've looked into this and it's going to be far less expensive for them to cover the medication than for all the necessary hospital visits if they're not treated? Does that make sense? Using health information. Okay, what's one of the first things we need to do in a community-based education program? What do we have to identify first before we can even build a program?
Who's at risk?
Who's our population? Right? We must determine the population, and then we can identify the issues. What's the education required? Select teaching strategies. Here's a good summary of your cognitive, affective, and psychomotor here in this paragraph right here. What's the teach-back method?
The teach-back method is having a patient or client repeat back what you taught them to make sure they understand it fully.
And performing the skill. Let's say
Yes.
if there's a glucometer or, incentive spirometer, them repeating that or showing you how to use it after you showed them. Right? And then the other thing is important here is learning styles. Have a look at this paragraph here. Adult learners have different preferred methods of learning. We give based on their generational characteristics. And there's a couple of examples. Generation X learners are self-directed, like to work in teams. The internet or the net generation prefers digital methods, web-based games, virtual reality. And then the baby boomers, the older people like me, still prefer instructor-led education. So please know the difference between those different adult learners. Because remember, in the community, the majority of your job is education. So you need to be aware of these things. The next section is government law and policy activism. Right? You need to understand what liability is. Right? 3 conditions need to be met for there to be negligence. Provider had a duty to provide reasonable care. There was some kind of a breach that occurred or an omission. And then the omission or breach caused injury to the client. Okay, so have a look at this section about how the government, the law, and policies affect community or public health nursing. And please have a look in this chapter at the Healthy People 2030 objectives. Okay. You also need to be familiar with the World Health Organization. right? And what their goal is. Their goal is to attain the highest possible health for everybody. Okay, this paragraph talks about the services provided by the World Health Organization. You got to know these. You're going to get asked about this. Okay, they monitor for adverse drug reactions, establish standards for vaccinations. They disseminate biomedical research, providing information on internationally occurring diseases. And then fostering collaboration for public health initiatives between countries. So you do need to have an understanding of the services that they provide and offer. Okay, and then there's a few other agencies here that you need to have an understanding about. One is the Agency for Healthcare Quality Research, talks about what it is, the CDC. Okay. The Healthcare Resources Services Administration, and then the NIH. So break down that paragraph. You've got 4 agencies. Okay, so this talks about international. The WHO is international. These 4 agencies are federal. Okay, so you may get asked about one of these agencies. You may have a question like, let's see, which agency is responsible for monitoring health, detecting problems, and implementing prevention strategies? And then all 4 of these are listed. Which one is it? It's a CDC.
CDC.
Yeah. Okay, so have a understanding, and this paragraph provides you that information. Have an understanding of what each of these 4 do. Okay. What's case management? We hear case management all the time. What do case managers do?
They manage the cases. For instance, in the hospital, if a Medicare patient needed a nursing home, they would facilitate that. And they would also, they were going home, then they would facilitate their transportation home.
Excellent.
Yes.
They're the coordinators, right? They're the coordinators of care. They case manage complex situations in which lots of resources may be needed or set up or need to be organized. Okay, their goal is for independence, right? And making the transition from the hospital to the home, or the home to the hospital, or the long-term care facility to home. Okay, they're always working for the health and well-being of their clients. So who might case managers work with? Maybe medical equipment companies, PT, OT, speech, mental health. Okay, so nurses are often in the case management roles. Case managers are discharge planners, they're admission planners, they're transition of care planners. Okay. And then you can have a look at the next couple is violence and human abuse. Review the information on intimate partner violence and abuse. Look at the risk factors. That's right in that chapter. Okay, this is important. Right here, primary prevention begins with a community approach to reducing violence and human abuse. It's a team approach. It may involve criminal justice education, criminal justice people, law enforcement, education, leaders in education in your community, social services, community advocacy. Everybody's working together to come up with solutions to reduce violence and human abuse. And here's some examples here of what communities have done. So be familiar with these. You may get asked a question about what are some ideas for reducing community violence and human abuse? Well, here's 5 bullets that are common in communities that they may be doing. Okay, so know this right here. Infection control, infection disease prevention and control. Okay, the following are some of the Healthy People 2030 immunization and infectious disease areas to focus on. STDs, pneumococcal infections, associated infections, vaccine preventable infections. Okay, we really focus on vaccines in community health. Not all families choose to get their kids or people vaccinated in their families, and that's okay. But we need to remind them and try and continue to educate them that vaccines are one of the most effective methods of preventing and controlling communicable diseases. Okay, and it talks about the childhood immunizations, the diphtheria, pertussis, measles. All right, so have a look at this. Have a look at this paragraph here with regards to vaccines and how we educate, how we identify who are the high-risk groups that may not be vaccinated. Okay. And here's a section about HIV, hepatitis, TB, and STDs. That was in the chapter. One of the weeks we covered these 4 communicable diseases. We're going to be doing surveillance outbreaks this week. Okay, so if you already haven't had your lecture this week, this will be covered. Okay, so I'm not going to go through that now. All right, this is a really good, I'm just going to stop here. This is a really good study guide. Okay, it's a good summary of your 3 weeks of coverage. Okay, so I always say to my students, start with the study guide. It's a summary. It's an excellent summary of what we've covered over the last 3 weeks. If you don't understand any of these bullets, or you think, I remember going over that in class, but I need to reread or re-educate or gain more knowledge, go back to those areas in your book and have a look. The study guide was put together from your book readings, your notes, your lectures. Okay? So start with that. Don't overdo it. Start with your study guide and see how comfortable you are with the study guide. Does that make sense?
Yes.
Don't go back and read every chapter from start to finish.
Yes. I think that's what I did last time. I should have paid much attention on the
Do not do that. It's going to be too overwhelming. Like I said, again, so this week's content, if you haven't had it yet, may be a bit unfamiliar to you from the study guide. But after this week's content, everything should, click into place. All right. And if it doesn't, you've got to go back and reread or re-listen to the lecture that covered those topics. Does that make sense? So start with your study guide, see how you do. If you read your study guide and you think, crap, none of this makes any sense, you do have to go back and do your due diligence, but it should be familiar to you. Does that make sense?
Yes.
So I'm just trying to give you how to tackle the study guide. Tackle the study guide first, and you'll have a good understanding of, I'm familiar with that. Yes, I remember that from class.
I don't know what our
yes.
fucking exam is though, bro.
What?
Oh, excuse me.
I'm sorry?
That was a mistake.
Oh.
My mic off.
Okay. Okay, well, that's what I have for a review. You'll get recordings of all the reviews this week. That's the information on your study guide is what's expected to be on the exam.
Thank you.
Okay. Is this helpful?
Thank you. Yes, ma'am.
Okay. Okay, yeah, I will send the attendance to the professors of who came. Yeah. So thank you for attending. Good luck in your exam. Reach out to any of us if you need additional tutoring. I always tell my students, please go through the study guide first and see what you understand and see what you don't. If before the exam there's some concepts that you're not understanding, reach out and schedule a tutoring session, and we'll go through those. We'll go through those sections that you don't understand before the exam. Okay.
Okay. Thank you.
All right.
Thank you.
You're welcome. All right. Have a good day.